So we're talking now to Polio Survivors Ireland, and in person here today we have Emma Clarke Conway, who's a Communications and Development Officer, and also Eddie, who is a polio survivor.
Yes.
You're both very welcome to the show.
Thank you very much.
Thank you.
So I might start with you, Emma, and just ask you about polio. What is it? Where it came from, and how many people are affected by it?
So polio is a disease that's actually been around for thousands of years. They've actually found Egyptian drawings where it shows somebody with one leg thinner than the other, which is a very typical polio trait. But it would have been, I suppose there was epidemics in all around the world, but in Ireland we would have had epidemics in the 40s and 50s. And what would happen was a child could wake up with a fever and just not be able to stand. And they might be then taken into hospital. They might need to have an iron lung to help them breathe. It could affect different limbs. It could affect all of their limbs. And then it would have required rehabilitation and operations to get them mobile again eventually, and perhaps left with some form of disability as a result of polio. So it's a virus, and it would have impacted on people's mobility is the biggest issue, I suppose, but it would have affected breathing as well.
And are those the only symptoms of polio?
Well, interestingly, there are people who maybe had polio and never knew they had polio because it was a little bit like COVID, where it was so mild, it wasn't picked up, they weren't particularly ill. And then there's the more severely impacted people who, like we've had stories of people who the parent got them out of bed to dress them in the morning and they couldn't stand up, they'd just fall over, or they would have more obvious symptoms like be kind of sick with a high fever, so they would be the sort of typical symptoms for polio.
What did people put it down to in those days before everyone understood that it was a virus?
Well, it was called infantile paralysis because it mostly impacted children and because it would have paralysed them effectively. And that's how it was known until probably I think the 40s or 50s then. It was the polio virus or poliomyelitis became the medical term, and then there was research into the vaccine, which was finally the vaccine was announced, if you like, in 1955, and that was Jonas Salk, and huge work had gone into that over many, many years. And people stopped in the streets to announce that this safe and effective vaccine had been found. So that would have rolled out across the Western world, and it would have probably been rolled out in Ireland in the 60s. So we'd know of people who maybe missed the vaccine by a couple of months. They just literally contracted polio, and the vaccine came to their area not long after that.
Okay.
So,
are there many sufferers?
So we have estimated that there are at least 5,000 people still living in Ireland with late effects of polio and suffering with the impacts of having had the disease. It's very hard to work out how many people had it at the time, but it was extremely prevalent, especially when the epidemics happened. A little bit like COVID, there's so many correlations there. Things would have closed down, and particularly Cork one summer was badly affected, where children were warned not to go to swimming pools, libraries, they were kept home, the streets were empty. There's actually a fabulous poem about that really paints that picture that we now know because of lockdown. So it did really, really frighten people, and it could affect adults, but mostly it seemed to be children, probably because it was an infectious disease, and it's easier for stuff like that to be transferred with kids, and then it could be picked up in sewage water. So if children swam in rivers, which they would have been more prone to do back then, they may have contracted it that way as well.
Wow. And what about new cases since the vaccine is there? There's none, is there?
There hasn't been a documented case since the late 80s, 90s in Ireland, and probably the last and they would have been vaccine derived, which is very unusual and more accidental than anything, unfortunately. So I think it sort of petered out in the late 60s. I wouldn't have an exact year, but there thankfully are no new cases in Ireland.
Very good.
Unfortunately, as we're all kind of aware of the situation in Gaza, it's arisen there again, and they are trying to ensure that vaccine coverage gets back through the population of kids, and it has happened. It was detected in London sewage water, I think 2 summers ago. Again, post lockdown, there was maybe a reduction in the vaccine coverage because people weren't bringing their children, or stuff like that gets overlooked, and they had to really do a big vaccine campaign to try and make sure to bring up that coverage to ensure that it couldn't come back. So it's endemic still in a couple of countries, and until it's completely gone, there's always that tiny thing there that you have to be aware of. And I think it's why young people especially need to know about polio, because if younger people who are having families, they need to know this is why you get your vaccinations, and it's so important that people do that to make sure that this horrible disease never comes back to Ireland.
Bad hygiene conditions are a big factor, are they, in causing it, in places like Gaza?
Yeah, that can be a factor, and it's arisen in places where, say like Pakistan and Afghanistan, where it's harder to get to people, so that's part of the problem.
And what about people coming in from other countries? Is there a danger that they could take it with them, or?
No, people coming in from other countries, they're not going to bring polio here. I mean, we've got very high vaccination coverage. I think you have to have, like in the 90s, for there to be. It means that the population is safe, if you like. Yeah. The issue of people coming in from other countries is that we are seeing a lot more younger polio survivors coming to live in Ireland, and they are very often worse affected because they didn't have the rehabilitation in their country of origin that we had even in the 50s and 60s. So we're encouraging anyone who's come to settle in Ireland to make contact with us, that we can try and help them, because they're very often far more severely impacted and have worse disabilities. They might be in a wheelchair, whereas somebody who had polio in the 50s, 60s, 70s, even in Ireland, wouldn't be in a wheelchair now. So we know there's a lot of people who need more help.
What about Post Polio Syndrome? What's all that about?
So that's a condition that was, I suppose, officially discovered in the 90s. And it's the reason our organisation exists. In short, it's a neurological condition, and it can affect somebody who's had polio between 20 and 40 years after they originally were infected. And people will see a gradual decline of their mobility, and they may, having maybe walked with a caliper or a stick, or maybe not even having not needed either, may start to gradually find they need a stick. They might need eventually to start using a mobility scooter to get, when they're out and about, and then eventually perhaps will fully need a wheelchair. Everybody's affected differently, and it probably depends on the severity of the polio you had when you were younger, but it is a really tough condition. And there's also a condition that we call late effects of polio.
Just going to ask you about that.
There you go. So they're, in a lot of ways, they're one and the same, in that, somebody of a certain age will be affected by having late effects of polio. The Post Polio Syndrome aspect needs an official diagnosis, and that can be hard to get, because it's just by elimination that will be diagnosed. and you need to see a neurologist and so on. So there's probably a lot of people who do have post polio syndrome but don't realise they have it. Right. But either way, we blanket it under late effects of polio. And someone who doesn't have post polio syndrome necessarily might still have those late impacts where, you know, they've walked with a limp all their life and now the good leg goes because of overcompensation, arthritic changes as well. And they do seem to suffer also with the intolerance to cold because of your circulation and your mobility, and that can be affected as well. And that's a huge issue for any polio survivor.
Very good. I might bring you in now, Eddie, and you might tell us a little bit about your history, how you ended up with polio, well, and where you were diagnosed and so on.
It would have been 55, 56. My mother found that I had a bit of a cold, and she brought me to the doctor because I wasn't getting any better. And it ended up, he got me shifted to Cherry Orchard because that's where most of the people ended up that had polio.
Did he think that you might have had polio? Right.
He was on the ball. He got me over there. And the thing about over in Cherry Orchard was that people that had polio, even up from the country that were there, when their parents would come to visit them, they were stood behind a rope about 10 foot away from the child, that they weren't allowed near the child.
How old were you at the time?
I was 3.5.
Wow, that's horrible.
And, well, we lived in Finglas, and my mother came up every day to see me. And then the doctors were checking people, and if they thought they were getting worse with the breathing, they'd put them in the iron lung, and which wasn't a nice thing to be in. But
horrible thing.
Especially if you're a child, yeah.
I was lucky enough. They told my mother one day, if he's not improved in the next 12 hours, he's going in the iron lung. Lucky enough, my mother said a prayer, and the next day she went over and I was still out of it. So and then I went to school, and then they were given the sugar lumps.
Right.
The vaccine.
I remember.
Yeah. And I was in class one day, and the doctors came in with the sugar lumps, and I went up to get a sugar lump, and all the other lads said, "Hey, he can't get a sugar lump. He already had polio, you know." Doctor said, "Here, it won't do you any harm."
Yeah, good.
So it was just a progression then, and what happened was the effects, the way I was affected with the polio was my nerves in my back and some small muscles got the polio, so they didn't develop.
Wow.
So part of the post polio is when you get older. I was young, so my good part of my body was able to compensate for the one that was affected.
I get you.
But when I hit 50, I was getting older.
And that's when the post-polio
kicked in because I was not able to, my body was not able to compensate anymore. And gradually, since then, it's got worse and worse and worse and worse.
And what's life like now? Are there things you can't do?
Oh, yeah. I mean, there's... I can't exercise as much as I'd like to, because part of this is if you overdo it, it'll take you 2 or 3 days to get back. That's if you do get back your energy, you know, and the use of your limbs. And sleeping, and part of the post-polio is you get tired very easy.
Right.
And as you know, I found out because of my job, my last job, I'd be sitting waiting to go out to work, and next of all, it'd be like a tap. All my energy would be gone out of my body, and I couldn't go to work.
Wow. What did you get?
Taximan.
Right.
And you needed your wits about you back then. But so it affects people in different ways.
Yeah. But it's still debilitating.
It is debilitating because I normally go to bed about 9 o'clock, 8:15, 9 o'clock, to stretch out on my bed. Because I need to stretch because of the back. And then when you get some other things that might happen to you. But I know I'm in a group that we have 5 wheelchairs in it.
Right. I was just going to ask you about that. That's a peer support group, isn't it?
Yeah.
And what do they do?
Well, what we do is we meet once a month. We meet the last Wednesday of each month to make it easy for people to remember the day. And we go and we discuss, how things are doing and how are one another. And then we have what we call a moaning 10 minutes, where each of us will take 10 minutes if something happened during the month, like if we got extra pain or if we done this. Yeah. And it's a way of, as I said earlier, we noticed the chap that was suffering. He said, look, we have this and getting this. And he was told to go to the hospital, and it ended up he needed a stint for his heart. Yeah. So the moaning 10 minutes is good because
it's sharing problems.
It's sharing the problem.
Yeah.
And people that they could be afraid to bring up things. But if they hear somebody else saying it, we have that, we have that. Yeah. Because everybody doesn't suffer the same way.
I get you. But you might hear how somebody managed.
Yes.
And you might get some clues how to look after yourself.
Yeah, it's as simple as, somebody came and they were talking and they were saying, well, I used to help with the vegetables over the sink, peeling them now. I can't do it anymore.
Yeah.
Because I can't stand.
Sit down.
Get a chair.
Yeah.
Things like that, that easy things that other people.
Yeah.
And that's why it's so important to have the groups. I think we got 4 or 5 in Dublin.
Right, all that are around?
Yeah, one in Tala, one in Bray, one in Colester, one in Swords, and then there's others around the country.
I get you.
And COVID must have been a complicating factor then, was it?
It was, yeah.
Some of the groups met on Zoom, but that didn't work for everybody. Especially, a lot of people might not be overly keen on technology, so that was hard.
Especially older people, they wouldn't be used to it.
But we're working to try and get a lot of those groups around the country back up and running now, and a lot of them have started to meet again because people are keen to talk and to see each other.
So Emma, I might come back to you now and ask you about the organisation Post Polio Survivors. Yeah. What that's about and when did it come on stream?
So 1993, we were founded as the Post Polio Support Group, and it came about because a couple of polio survivors had started to realise they were having similar symptoms, but doctors weren't listening to them, and they were feeling as if something needed to be done. And one had been in America and had picked up some literature and discovered that this in fact was now a recognised condition. So they wrote letters to the papers and they asked for people to contact them from all around the country, which they did, and gradually this small group of people set up this charity, and it grew from there. So we're 31 years in existence now. We changed our name to Polio Survivors Ireland to reflect that it doesn't matter if you don't have Post Polio Syndrome, you can still be a member or contact us for help even without being a member. And we have a polio register which we established a few years ago to try and reach more people as well. So what we do is we have 2 service coordinators that you can call and talk about your personal situation, and they will try to see if there's anything that we can help with. And the kind of services we provide would be access to physiotherapy, chiropody, counselling and respite breaks. We also, for people who are really struggling with the cost of heat because of the intolerance to cold, we provide a winter heating grant, and we would do we would try to arrange occupational therapy if somebody needed it, so that
that's a big thing, isn't it?
It is, yeah, it's a big thing, because there's so many. There can be waiting lists. It can be difficult to get an OT, so we can help sometimes with that. So that you can be assessed to see what wheelchair or mobility scooter might suit you. And then sometimes people need help affording those, or affording stair lifts, which are massively expensive. And obviously some stuff is covered by the HSE, or people may have medical cards, but there can be big waiting lists depending on where you live. So sometimes people need our intervention to help get them mobile and keep them mobile, and that's our big thing, is helping people to maintain their independence for as long as possible, and make sure that they can get on with their lives as much as they can.
So it must cost a lot of money.
Yes.
Do you fundraise?
Yes.
And if so, have you anything upcoming?
We the kind of what we have. We're trying to do some corporate fundraising. We're trying to develop corporate partnerships. We're trying to appeal to companies for donations. And like years ago, we would have done a lot more backpacks and, community fundraising. But our members are not able to do that anymore. It's not fair to ask them. So we've tried to change the focus of how we fundraise. But we're always open to donations, and you can donate on our website, polio.ie. So feel free, if anybody out there has any money pre-Christmas that they'd like to pass on to a charity, we would be very happy to have it. And that particularly funds our winter heating grant, because we don't get any HSE funding that would cover that. We try to apply for a lot of grants as well. Any foundations or trusts that maybe give money to charity. So it's difficult, but we manage, and it's a great cause, and we really see the difference that the help that we give makes to people. Yeah. Even like that small amount that they might get from us for the heating, it's something that they really come back and express.
And they might be struggling with them.
Yeah. And we have, we would try, like if there's somebody in a really bad situation for some reason, like we have hardship grants, there's different ways that we might be able to help, and sometimes it's just a listening ear, like what Eddie was saying about the social support, and we also have telephone support for people who can't go out, so that's peer-to-peer as well. Polio survivors helping other polio survivors, and that's what we are as an organisation. Obviously we've a small staff, but a lot of the work that's done is done by polio survivors, and they're all helping each other out.
Now, I saw a thing on your website about the National Polio Register. That seems like a very important tool.
Yes, so we established that a few years ago. I think it was 2017, and what we wanted to do was reach the polio survivors who maybe don't know we exist, or don't realise that we could potentially help them in a couple of years. They might need help now, and sometimes people say, oh yeah, I know that's there, but I'm okay. But maybe in a few years they might need a little bit of support, they might need information. What we see is a lot of people having falls, and they might need some help, like a caliper or a stick, and they're putting it off. So we feel with the register, if people sign the register, they don't have to become a member if they don't want to, if they're not ready to, but we can just gives us an opportunity to send them some information a few times a year and just remind them that we're still there. And also, it really important for us is it gives us that strength in numbers, so that when we're campaigning, which we're trying to do more work now with advocating and approaching the government and looking for things for polio survivors, it's important for us to be able to say how many survivors there are. Yeah. So the register is there to be signed on the website.
I was thinking about healthcare professionals. Are they getting better at understanding the condition?
I'll let Eddie answer that.
That's a firm no from Eddie.
No, not really. A lot of them, they don't know what polio is.
Right.
Do
you think that's because it's something from the 50s and we don't have to think about it anymore?
They weren't taught.
Right.
The old doctors would know about it. The new doctors know, because it's not taught.
And do you have to educate them?
Yes.
Wow.
The group have a book out that a few years ago we were asked to give to our doctor, our GP, and then they will know if
That's
they read
crazy,
it.
isn't it?
Yeah, well, I mean, they thought they had erased it.
Yeah.
They didn't know it was coming back.
Yeah.
We didn't know it was coming back.
Of course.
So it's a thing where you kind of have to go in and educate them.
Yeah.
Like I was with a diabetic nurse yesterday, and I got my bloods done a few weeks ago because I was going to her, and she couldn't get over how healthy I am.
Yeah.
Everything was perfect, spot on.
Brilliant.
But I need a walker, and I can't stand for more than 3 minutes.
Right.
But to me, I'm healthy. To them, I'm healthy.
Yeah.
I'm not sick.
Yeah.
You know, so
I understand that, though.
You know where I'm coming from. It's a thing where they're not being taught how to cater for people that have disabilities, like walking or calipers they need and all that. And it's very hard to get a good caliper now.
Oh, is it?
Yes, like the people that you were making them years ago are retired.
Right.
But they never passed it on.
Is that because they thought there was no need for them anymore?
That's it. They thought.
Yeah.
It's
crazy.
Like that, but that's what's happening. That's why the support group is so important.
Yeah.
That's
Absolutely.
there.
Absolutely.
That if you have a problem, you ring and you ask, and they will help you.
Brilliant.
But apart from that, I can't go to my local doctor or my clinic or whatever and ask them for something, because they won't be able to do it.
I get you.
You know, so.
Now, Emma, we're right at the end of our time. Is there anything else you'd like to put out there?
Yeah, I mean, just to follow on from what Eddie is saying, because I think it's important. Like we recently did a presentation in Leinster House, and we put in a pre-budget submission, and there were certain things that we're calling for, and one of them was actually highlighting the lack of physiotherapy that's available to polio survivors. Very often a polio survivor will go to a physio and they'll just be given the normal sheet of exercises, and that's no good to somebody who, like Eddie, can't stand for more than 3 minutes. So we want to see better provision of physiotherapy which is more tailored and suitable for polio survivors. And we as part of our strategic plan, we are working to try to ensure more health professionals are aware of polio and of Post Polio Syndrome and Late Effects of Polio. It's a big ask. It's a tall target, but it's something we have to keep doing, because even with, you know, the people who had polio years ago, there's now the newer younger polio survivors, so it's that condition is still going to be there, and those people will still need help. So we are just going to keep working towards making people aware.
I have to say I'm very impressed with your website. It's full of information, so if anybody out there is listening and they have a relative with polio, I'd advise them to go on the website. You'll tell us what it is.
I will. It's www.polio.ie, and I'll also mention our phone number if that's okay, because there's I'm always very conscious not everybody is online, and we're very much about contacting people in all the different ways, by phone, by text and by post. a lot of our communication to members is sent out by the post. Good. Because we're just, you know, we're not making that assumption that everybody can do online. So our phone number is 01889 8920, and we're there 9 to 5 Monday to Friday. If somebody has a query, they are welcome to call us.
Just give the phone number one more time.
It's 01889 8920.
Emma, Eddie, thank you so much for coming on the show.
Thank you.
Thank you for having us.
You're very good.